Welcome back. We now put the spotlight on the Hindi heartland, especially in Madhya Pradesh and Uttar Pradesh, where we've seen significant action by the state governments in the last couple of days. For example, in the state of Madhya Pradesh, there is now a complete lockdown, absolute ban on entry and exit of people in 3 cities. In Ujjain and Bhopal and Indore, there is a complete sealing that has taken place owing to the rise of cases of coronavirus. In fact, as per the state government, Indore has recorded about 170 cases, Bhopal has 96 cases, and Ujjain has also seen 13 cases of coronavirus. Then there are parts of 14 different districts of this state which are under complete lockdown. So then there are different pockets within the cities where people's movement is completely restricted. Shops are not allowed to open at all to ensure that we contain the infection as we speak. Like I have been mentioning, viewers, the larger trend we are seeing right now is that the states are clamping down, bringing in stricter regulations for specific zones where there are high number of cases or increasing number of cases. Now, some of them are in absolute lockdown with no movement allowed. Some are sealed premises where you cannot get out of a specific zone. The others are containment zones with very bare minimalistic movement. In the first category, people are not even allowed to get out and buy their essential goods. Everything will be home delivered to them at their doorstep. Absolutely no moving out of your homes. Madhya Pradesh and Uttar Pradesh has multiple of these instances. So in fact, from Madhya Pradesh, I want to now tell you what is happening in the state of Uttar Pradesh, where in 15 different districts, they have actually made this announcement that in specific localities, you can't just step out at all. The UP government has ordered a complete shutdown in various parts of these 15 districts. These localities are in the cities of Lucknow, Agra, Ghaziabad, Gautam Budh Nagar, Kanpur, Varanasi, Shamli, Meerut, Bareilly, Bulandshahr, Firozabad, Maharajganj, Sitapur, Saharanpur and Basti. All essential services will be home delivered and nobody will be allowed to move out except, of course, the healthcare workers and those who are linked to the essential services. Now, what is really the game plan? How are they going about dealing with the whole situation? I'll actually have UP Minister Sidharth Singh joining us right now on this special broadcast to give a sense of just how they are going about this entire issue. Mr. Sidharth Singh, good evening. Thank you for joining us. Can you begin by telling us how you are managing to ensure that essential services actually reach people in places where there is a complete lockdown and they're not allowed to step out? Mr. Sidharth Singh, let me attempt one more time. Are you able to hear us? If my audio is going through, Mr. Sidharth Singh, I wanted to begin by asking you what's the plan for these parts, localities in the 15 districts where we've said people cannot be stepping out at all. Obviously that means that everything will have to be supplied to them. Otherwise, things will become extremely difficult. I'm not too sure if Sidharth Singh is able to hear us right now. We're going to try and patch him again and get more details from him right now. Okay, let me just see if we can patch that line with him again. Meanwhile, let's listen into what the Uttar Pradesh Chief Secretary told us.
इन 15 जिलों में जो हॉटस्पॉट्स डीएमएसपीज ने आइडेंटिफाई कर रखे हैं, उन सभी हॉटस्पॉट्स पर जो है पूरी तरह से सख्ती की जाएगी और लॉकडाउन का मतलब लॉकडाउन, वहाँ पर कोई भी जो है व्यक्ति जा नहीं पाएगा। ये निर्देश उन्होंने आज दिया है। उस कड़ी में उन्होंने डीजीपी साहब को और मुझे कहा है कि अभी 3 बजे बैठकर सभी डीएमएसपीज या पुलिस कमिश्नर्स के साथ उसके पूरा प्लान ऑफ एक्शन अभी तुरंत बना के शाम 5 बजे तक उसको सबमिट करें। इन लॉकडाउन के एरियाज में कारण यह है कि जहां जहां भी 100% लॉकडाउन किया है, वहां तुरंत डिजीज का लोड जो है घटा है। कॉन्टैक्ट्स की ट्रेसिंग करके वहां पर ऐसे लोगों को आइडेंटिफाई करके क्वारंटाइन में भी भेज दिया गया है और कोई भी व्यक्ति चाहे वो किसी जगह का भी हो, वो आगे जो है डिजीज को बढ़ा नहीं पाया है। आगरा में इसको बहुत सफलतापूर्वक कुछ एरियाज में शुरुआत में किया गया था, उसके अच्छे रिजल्ट निकले थे। इसी कड़ी में जो है आज ये निर्णय माननीय मुख्यमंत्री जी ने लिया है।
Mr. Sidharth Singh, I'm going to try my luck here one more time to see if you can hear me. Yes, no, now I can. Now I can. Thank you so much for joining us. I appreciate you also being patient about this. Mr. Sidharth Singh, just let's begin with what is the overall strategy for Uttar Pradesh. Would you want the lockdown to be extended post April 14th or an overall staggered lifting of the lockdown?
It will be extended, but we have gone ahead with a certain formula of, I would say, sealing the hotspots. And now, whether the hotspots, while we are sealing, totally sealing, it gives us a good result. Although the Kanpur did give us a good result, if that gives us a good result, then certainly that could be a way forward after 15. But I will not say that is the way forward. So let us wait till 14 and what are the results of sealing the hotspot, and if required we may continue that way, or we may just continue with the lockdown of the total all the districts, or we may just lift it in consultation with the government. So all three options are still open.
Okay, so what I was actually earlier asking you, and we couldn't hear you at that time, Mr. Sidharth Singh, in the specific 15 districts where there are parts which are in absolute lockdown, how is the state ensuring that everybody gets the essential goods, necessary medicines and whatever help is required?
Well, as the essentials are concerned, including the medicines and including the medical care, those availabilities are ensured by the state government. And to their doorstep since morning, if your cameras had rolled, since morning there were, essential good services vehicles around there at the sealed gates, I would say, and people have been given, so they all are quite satisfied by now, and they know that government is there to take care of their essentials. And if there are medical requirements, then 112 is a quite efficient working in Uttar Pradesh. That can be approached, and the answers will be given. So, including the hospitals we have identified near to the the sealed areas. So all those infrastructure availability, infrastructure for delivery of the essentials, all these things have been taken care by the government while announcing.
Okay, there are two big challenges, especially for states like Uttar Pradesh. Let me begin by asking you about the Tablighi attendees. Has the state managed to trace down everybody, or are there still concerns that some may be hiding, not revealing their travel history?
Well, if you look at our numbers, particularly the Tablighi Jamaat did add to those numbers, and substantially they have added to those numbers. But we got the list from the central government. There were about 569 odd numbers. They all have been identified and they have been approached. They have been taken into quarantine. They have been tested. So that part is over. Whom they had met, or the people who came in contact in UP, they have been also, the list has been prepared, and mostly all of them have been taken into quarantine. So about 63,000 in UP, including them, are in quarantine, and we have enough beds, we have enough facilities available. So I don't see that a problem anymore, but certainly it did add to a problem initially. It was unfortunate. I think many other states that unfortunate of Tablighi Jamaat, and they continue adding because they have a habit. Some of them we had taken for testing, and it's very unfortunate. While they were in the hospital, in district hospital, they started spitting around or creating little ruckus there, and sitting around was not a good sign of what the intentions could have been, or the intentions were there, and then the country would have faced the problem.
Okay, the other big challenge, Mrs. Sidharth Singh, was that of migrant workers. Now, while we've come a long way from the time when they were out on the streets, walking down from the national capital and other areas back home in Uttar Pradesh, the second part of the challenge is what if any of them had been exposed to infection and have now gotten back to their villages? How is the government dealing with that situation?
Well, initially it was a load which was more than 1 lakh. But I think that issue is over. That crisis is over in Uttar Pradesh, and we have ensured that those who needed, firstly they all have been tested. Then wherever they have been, their villages, they have gone under the Pradhan system. They are in their houses, and we have a lot of health workers in the rural areas, particularly the Asha and Anganwadi. They all are they are monitoring them, and we have been doing a program of communicable disease in Uttar Pradesh since 2017, and that training program goes to almost about 1 lakh of health workers, and they're the frontline health workers. So they have been trained, and communicable disease is also coronavirus, so they are well trained. The protocols were also issued to them, so they are taking care, and if there is any signs which shows in their respective quarantine, in their self-quarantine, in their houses in the rural area, then certainly the government they are taken to the hospitals. So all that is in place, and so far all is doing well, and hopefully we haven't seen any results coming from there, those laborers who had moved. So I don't think a single case has been heard of them.
Okay, my last question before I let you go, what is it that the state would require from the center at this point? Do you have enough rapid testing kits, protective gear which may be needed in the coming days as the number of cases go up and testing also goes up?
Well, UP is already, we have gone into, along with the central government, and also purchases, about 150,000 or 2 lakh rapid testing kits would be arriving in less than a week's time. And once that starts, I think that will be a very intensive testing being done in Uttar Pradesh. This will certainly help in identifying and detecting, and then if required, then taking them to the various hospitals which have been identified. Enough beds are so far available. So all those things are in place, the infrastructure is in place, but it will be a good, I would say the rapid testing kit would help in curtailing the fight against the coronavirus.
All right, Sidharth Singh, thank you so much for joining us. Really appreciate you taking the time out and speaking to us here on Mirror Now. The efforts taken by the government are much appreciated in this hour of need. Thank you. That was the UP minister telling us about the status of affairs in Uttar Pradesh. Like I told you, about 15 different districts have actually seen significant clampdown, including Noida, Lucknow, Agra, Varanasi, Kanpur, where in specific localities now door-to-door delivery of essential items is being planned and will be carried out, because people are not allowed to step out at all. So all shops have been shut down, and this is being done to ensure that there is not even a possibility of violation of social distancing, because as you know, from the state of Uttar Pradesh, especially in cities like Kanpur, we saw many examples coming in the initial days where people were just roaming around the markets, queuing up, completely disregarding the social distancing norms, and that was becoming a big challenge. But as far as the Tablighi attendees are concerned, the minister says that they have pretty much managed to track down everybody. They're all in isolation and quarantine and under their radar, and they've also managed to now keep an eye on all the migrant workers, about a lakh of them that had initially moved back to their homes. So far, that has not become a challenge in terms of the spread of coronavirus. Let me see if we can go across to Sujata Rao, former Health Secretary for the Government of India, joining us right now. Ms. Rao, thank you so much. I will apologize to you for keeping you waiting. We've had a series of technical glitches as we try a new setup. I appreciate your patience. Ms. Rao, what's your own view? Should we move towards a more targeted lockdown post April 14th, or should the country continue with a blanket lockdown?
Well, first of all, thanks for having me. Lockdown is not this solution. What's the lockdown? Give you time to get your infrastructure and your tests done, so you are on top of the situation before any takes over. So therefore, these weeks did give us time, but I think the rate of business right now, kits have to come for PPE, kits have yet to come, and we are starting to stabilize mobility. Students work that indulged in. I think right now, I don't think government will lift the lockdown immediately. We'll have to, can do, is have the lockdown, but as a UP and quickly ramp up thing and identify spots, get a much scrutiny there to flush out who are infected. That is the most important thing. And once we have that control, then it's possible to identify areas getting infected. Probably they can be lockdown can be moved over there, but it has to be done in a graded manner. It'll have to be stage-wise manner, so that we don't benefits we got at this 51-day lockdown. We don't lose by opening up and losing control over the epidemic. So it has to be strategic.
Ms. Sujata Rao, if I can just come in here and ask you this question, do you think that at the rate that the number of cases are increasing, India is ready to tackle a larger healthcare burden in terms of beds and ventilators and healthcare workers themselves?
Much India's health system, and particularly those who not the best of time. So now pooling in resources and substituting the focus on COVID with elective surgery being attended, routine health, OPD is not, and so on, ramping up infrastructure to really treat whatever of patients we. But that is up to beyond. It won't be possible for India and more the northern states to really be able to cope with the situation. And that is the primary reason why lockdown is useful, because as you come, it flattens the curve and it creates a pause so that you get cases in accordance with the scoping system we have, and suddenly hundreds of them. So it's very critical. That's the kind of strategy that is being followed, and I think the beneficiary of the circumstances we're in.
Okay, I understand what you're saying, but I just wanted to also check with you. What would be the key learnings from what we've seen in the last couple of weeks if the government had to sit today and decide that, okay, let's extend the lockdown for a bit more? What should be the key focus area to ensure it doesn't become painful or difficult for people?
Well, to begin with, test and first of all, get to know what the virus is, who are the infected people, flush them out, isolate them, and see that spread the infection. So contain infection and then later to mitigate is a single important priority. So that process, it seems to do very well, which I'm glad they've done. I think good response. But nevertheless, still have to increase 5 times, if not more, and we have much more data on about this virus. So it's very critical to get out of the situation. Testing is the most important requirement than anything else.
All right, Sujata Rao, I appreciate you joining us right now. I really wish we could have a more exhaustive conversation. I really look forward to having this conversation with you maybe another day. But thank you so much for taking the time out and joining us this evening. Just tonight, technology is not on our side, viewers. We are trying the best we can to bring you the news and bring you the biggest of the experts and the voices from various states. We'll continue to do that. We're going to take a very short break. Come right back with lots more. Welcome back. We now put the spotlight on the national capital and bring you the latest on what's happening over there. Almost a month ago, about over 3 weeks ago, the Delhi government began in the direction of bringing in restrictions. The first set of restrictions asked people to not gather in large groups. Then came the restrictions further of not going to malls and clubs and gyms. Now, obviously, 2 weeks into the lockdown, the situation is completely different. But we've got reports emerging now that many of the healthcare workers are either being targeted, ostracized, or they're also testing positive. So there is a risk as far as the healthcare workers are concerned. and them being exposed to the possible infection. Today, in a couple of parts of the national capital, there was an absolute shutdown where people could not step out even to buy the daily essentials, to ensure that there is no violation of social distancing, or in general no gathering of people. Let's go across to Alok to get you the latest as far as the national capital is concerned. Alok, in the neighboring parts of Noida and Greater Noida, we know there were reports of panic buying. But what about Delhi? How was the day for Delhi citizens?
Well, definitely, it's difficult time for the Delhi Heights, and not only Delhi Heights, in fact, Pradesh also, because a lot of places now in these in both these states, a lot of places have been declared as the hotspots. Hotspots. If you talk about the hotspots, the measures what the government is taking as the after declaring them the hotspots are the same in both Uttar Pradesh and also Delhi. So definitely, the restriction is that no shops will be open. The second is that only fire department, Delhi government, and health department officials can go to these areas to do the sanitization work or to identify the people if they are affected with any kind of influenza and to control the lot of transmission that is other Delhi police and definitely sanitization is being done by the Delhi Fire Department services or the other departments. So these are the places, these are the departments that are allowed. But apart from that, some people are not allowed to come to their homes. Particularly for Delhi, 20 places were marked as hotspots, but they do 4 places included, that includes Bengal, market Bengal is the heart of the capital, very near to the Connaught place, and that also included as the hotspot because the patients were found to be coronavirus affected. So definitely the whole situation what we can say about is very much happening. And as of now, and those are that if from Delhi and both the places are the administration are now. And we hope that those people who are in the hotspots will definitely take care of that and whatever the government actions are there.
All right, Alok, thanks so much for joining us. In fact, let's take some of those pointers that Alok was giving us and take it across to Akshay Marathe of the Aam Aadmi Party, who's joining us right now. Akshay Marathe, I want to actually start off with Operation Shield. Can you explain to us what that is and how is the Delhi government going about it?
Yeah, of course. So, from the first day that the first COVID case broke out in Delhi, we have been very proactive in trying to trace and isolate any cases. We have seen what has happened around the world, and the only effective way to stop a COVID outbreak in the city is to test and isolate. So that is what Operation Shield is all about. If you look at the last few health bulletins that the Delhi government has come out with, you will see that there have been some cases under investigation. So Operation Shield has been launched after investigating those cases and figuring out 22 hotspots in the city where we think there could be a possible outbreak in the future. And that's why all those areas have been completely sealed off from the outside. So nobody can enter that area from the outside and nobody can actually step out of that area. All the people living inside that area have been asked to home quarantine. There is Delhi police, civil defense volunteers who are enforcing this. Everyone is being isolated. Those who have any contacts to any confirmed positive cases are being traced. All essential supplies are being ensured for all people living there, and the entire area is being sanitized with disinfectants to prevent any kind of contact transmission of the virus. And the final aspect of the Shield operation is that our officials will go door to door to every single household in that area and conduct a survey as to whether anybody has any symptoms from the list of COVID symptoms that are now established as the symptoms to look out for. So this is our strategy to ensure that any COVID cases are not found outside of these 2022 hotspots in the city. So that is what Delhi is looking at for the next 10 or 15 days, where this is going to be a crucial part of the fight against corona that Mr. Kejriwal has launched today.
Okay, there are many parts, just like here in Mumbai and in Hyderabad, even in Delhi, where there is a complete lockdown. People can't step out. Essentially, about 15,000 reports suggest 15,000 Delhi citizens are in a complete lockdown. How are you ensuring that they get their essential supplies? What's the mechanism in place?
So this is a pretty large number of people where door-to-door delivery of essential services would be a challenge. So what is being done is that the demand in these areas is being mapped, and all the supplies that are needed by the people there are actually being allowed to be sold inside. So using social distancing norms, we are allowing people to actually purchase those items, but only from within that zone and not from outside. So for instance, if you have one gully of any mohalla which has been made part of Operation Shield, you cannot step out of that gully to purchase your essential items. You can only purchase them from within there based on the demand mapping that has been done by our officials. And Delhi police is manning the entry and exit gates of these areas to ensure that nobody who does not require to go inside for any essential item supply can go inside, and nobody can actually step outside of those zones to buy any of the essential items that they require.
Okay, so is there an emergency helpline for emergency needs, especially medicines, where people can call, or if there are essential specific food items that are needed at that point?
No, as of now, for these areas, there is no specific helpline. But as you can imagine, these are very small areas, they're very small regions. So every region has police and civil defense volunteers, other than health officials, of course, who are manning these areas physically. So anybody who requires anything can actually walk up to those officials and talk to them about it. These are not large areas, they're very small, and therefore it can be sorted out in this manner. But with time, we will take feedback from people, we will understand what are the requirements that these people have, and we will of course tweak our strategy based on that. In the future, if we require a helpline like the kind that Noida has, Noida of course has a much larger spread, which is why it requires a helpline. But if in Delhi in the future we do see a need for something like that, then the AAP government will definitely think of such a measure.
Well, what does the Delhi government need right now, Akshay? In terms of equipment or resources from the center, what help have you sought?
I think what Delhi government needs urgently right now is PPE kits, personal protective equipment kits for our medical staff. We had asked the center to give us on an emergency basis, we had asked for 50,000 kits last week. The center has written back to us and allocated 26 or 27,000 of these kits to us, which we expect to be delivered anytime now. But this is not an enough number for a longer term perspective. We are looking at various sources to actually procure these. We're talking to several suppliers to ensure that Delhi has enough PPE kits. Delhi in the next few months is going to require at least 4 to 5 lakh PPE kits to ensure every single person on our medical staff has the equipment needed to tackle COVID. But other than that, at this point, I'm sure you have heard about this, but Mr. Arvind Kejriwal, the Chief Minister of Delhi, announced yesterday that all government expenditure other than that is needed to be done to tackle COVID is now being suspended completely. What this means is that the state government, because there is no economic activity going on right now, even the state government does not have revenues to run any initiative other than the immediate steps needed to tackle COVID. So the other appeal that the Chief Minister has been making is for people to donate generously to the LG Chief Minister Relief Fund of the Delhi government. so that all essential services can continue without any hassle, and we don't have to look to the center for funds, because Delhi has enough and more people who have the wealth that Delhi would need to sustain itself. We are the national capital, we are self-sufficient. So the Chief Minister has repeatedly also appealed to people to, they can do so now by logging on to the Delhi government website, delhi.gov.in. I think things are the most critical things on the, thankfully, because has been very aggressively pushing healthcare reform. Right now we have 400 ventilators in our government facility, and we have 400 or so in the private hospitals of Delhi. As per our own calculation, if there becomes a situation in Delhi where we have 30,000 patients who require medical attention in hospitals, we will need 400 ventilators. But even as of now, we have 800, more than double of those in Delhi. In the future, there may come a time when we need more ventilators, but in the next couple of months, as per the projected, COVID-19, Delhi has enough ventilators, enough hospital bed capacity, enough medical staff, and all that is lacking right now, like I said, kits, which we are also procuring.
Okay. Akshay, I'll request you to stay on with us as I move to a larger part of the conversation, and also say good evening to Dr. Raj Panda, public health specialist, joining us right now. Dr. Panda, what is your sense? We've got just about 4 or 5 days left for this 3-week lockdown period. Obviously, the entire focus now is about what happens post April 14th. Is India anywhere close to taking a decision on lifting the lockdown?
Yeah, thank you. I think it's pretty certain that it is going to be an extended lockdown. But how, where, and when is important. So now this hotspot has been active, and this is, if infectious disease is a spatial. But how we denote that we have this, what people do containment, be very careful about it. That can often panic. The other thing is the decision of a lockdown will have a lot of collateral, both within the health, economic, as well as social terms. So careful about that. Now, if you look at lessons from various other pandemics, we understand the strong between early, sustained, and layered applications of lockdown can actually mitigate the consequences of the pandemic. So we have done it. I think we did it quite close to the governments, both of the state. We have to make it sustained, but what is the objective of sustained needs to be clear. Is it to bring down our we do not know. We do not know whether herd immunity actually kick in and provide to the country. So in that case, I think a layered application of the lockdown would be useful. I know different terminologies. I just the Chief Minister used a term called shield, but I have my own 3 things which I would really recommend. One is test, and I call it TIPS. So the T is for tests, testing, T is testing aggressively and clusters, but also find new spots and test, isolate people humanly, and provide support. And the third thing which I've been hearing about my previous speakers seems that governments are ready to do it. Often, when you go in for a prolonged lockdown, those things can be problematic because you not just you.
Dr. Panda, my apologies to you. Unfortunately, the audio is really bad, and I don't think we're able to. Anybody is able to understand you at all. We're going to try and fix that line with you. I've said this earlier on the show as well. Technology is not on our side today, but we're trying to, do our best here to bring the reactions. Akshay Marathe, is there a thought process within your party and government on whether the lockdown should be lifted in phases or it should completely continue right now?
I think it's a little early to say definitively what should happen with the lockdown. But as our party has said in the past also, we will defer to the central government's decision on the lockdown, because we do believe that this is not a crisis that can be solved in isolation. It cannot happen that one state takes a unilateral decision in this matter, because it has to be all states together. If you imagine a scenario where one state is under lockdown and another is not, there'll be havoc, because even if one corona positive patient were to go from one state to the other during the lockdown, during a differential lockdown, then you would have a continued outbreak of the virus. So I don't think we can see a situation where different state governments should be taking different measures in this direction. I believe the Prime Minister is set to speak with all Chief Ministers, including Delhi Chief Minister Arvind Kejriwal, on the 11th of April. And that is perhaps when we would get an idea from different states and the Prime Minister, of course, about what is to be done with the lockdown. But as far as Delhi is concerned, after we announced Operation Shield today, I am confident that for the next 2 weeks at least, these 25 hotspots will remain under complete lockdown. So as far as Delhi is concerned, the lockdown in these 22 hotspots will definitely go past 14th of April. And I think that one must be prepared to see an extension of the lockdown in some form or the other. But like I said, we would leave it to the central government to take a final call on that.
All right, Akshay Marathe, thank you so much for joining us. Dr. Panda, my apologies, we've had a really bad line with you. Hopefully the next time we will be able to understand you better, and I'm completely out of time. So I'm going to leave this conversation here right now. That's the Delhi AAP representative telling us that the decision on lockdown has to be in consensus with the center and everybody else. And in a few days from now, we will find out what that decision is, viewers. Thank you so much for joining us on this conversation. Let's get you some more news reports.
One of the biggest crises has been that several nursing homes have found that their patients have actually been positive. This is the Millat nursing home. 2 people here were found positive, and which is why the dialysis in this particular place has actually been stopped. One of the patients who was actually admitted here has actually died because he couldn't get his dialysis. आप बताइए क्या हुआ था? आप कह रहे हैं कि किसी की मौत हो गई क्योंकि डायलिसिस नहीं हो पाया।
वो देखो मैयत वहाँ पे पड़ी है, एम्बुलेंस वहाँ पे खड़ा है, वो वहाँ पे अपना 4 दिन से इनका डायलिसिस नहीं हो रहा था। आज चौथा दिन है, 5वां दिन डायलिसिस। हम लोग ने कुपर में, बाला साहेब ठाकरे, ये कामा में, और यहाँ के जितने हॉस्पिटल है, यहाँ पे बोरीवली कौन सा, बोरीवली में जो BMC का है, वहाँ पे गए। पूरा टोटल हॉस्पिटल हम लोगों ने 50 से 60 हॉस्पिटल में गए, कहीं पे नहीं लिए। सब पैसे जो तुमको 1,000 की जगह 10,000 लो तो भी पैसे के भी नहीं, कोई चीज में नहीं लिए। आज जो 40 साल का आदमी है, होप हो गया, छोटे छोटे बच्चे, अब मैडम कहाँ जाएगा?
लेकिन उनका ये बंद इसलिए किया गया क्योंकि यहाँ पे कोरोना पॉजिटिव पेशेंट पाए गए। तो अगर यहाँ
ठीक है मैडम, कोरोना पेशेंट पाए गए तो उनको कुछ तो ये बताओ, लेटर भी नहीं लिख के दे रहे कि वहाँ पे लेके चल के दवा कराओ, तो हम लोग कहाँ पे जाएंगे? ठीक है, कोरोना हम लोग फॉलो कर रहे हैं, उन तो जैसा बोल रहे हैं वैसा हम लोग कर रहे हैं, हम लोग उसमें कोई तकलीफ नहीं, चलो उसके लिए बताए। मगर अभी वो डायलिसिस वाला तो मर गया, कोरोना से पहले ही मर गया वो।
That was a report that Kajal Iyer got for us from the city of Mumbai, where there is a massive problem regarding dialysis centers, as the biggest dialysis centers in Mumbai have actually shut down, leaving the patients in a lurch. In fact, earlier on this show, we also had Maharashtra Minister Aslam Sheikh with us, and he assured us that the government will look into it and take steps very quickly to ensure that the patients are given all the help that they need. Let's move on and give you another interesting story. Now, the government has decided to convert railway coaches into isolation centers. These coaches are actually being taken, sanitized from inside and outside, converted into isolation centers, and some of them are even mobile. So they can actually go to specific areas and zones where there is a shortage of beds and be used as isolation centers. In fact, Rahul Kumar got us this report from Chhapra in Bihar.
I am inside the isolation coach, and if you see, the tap is being changed, a very different kind of tap we see in Indian Railways. There is sanitizer, there is hand wash, and in the toilet there are some modifications which are being made. If we'll go and look inside, one toilet is being converted into a bathroom and other is being converted into a bio toilet. So we'll go inside and we'll check what else is made. Now this is in the very beginning, there is a doctor's cabin. Now this cabin will be used by doctors who will be treating the patient of coronavirus. Now there you can see there are 2 seats. Now inside, if you go inside, then starts the isolation ward. Now typically in sleeper coaches there are around 8 isolation ward. Now there are 2 seats, and in these 2 seats only 1 patient will be accommodated. Now some changes are being made here. Here the oxygen cylinders will be used, and this is almost 100% ready. Railway staff told me that medical team can anytime install their equipments over here. And now there are 3 kinds of dustbin which are being used. One is for glass, one is for paper, and other is for general purpose. Now we'll go inside and check what are the other facilities.
Let's turn our attention one more time towards Maharashtra and in Mumbai, where traders are facing massive transportation problem. Not only that, they are still struggling to get people, workers to load and offload the goods. As they say, number of people turning up has actually halved now in the times of lockdown. Here is a report that Neha Kulkarni got for us.
With about 50% staff at work in Vashi's APMC, the Grain and Retail Association claim that they are trying to ensure that the supply chain network of food and essentials in the city does not get interrupted. Now, initially there were issues, but more or less by managing the social distancing measures, they are ensuring that the supply chain of food and essentials in the city does not get affected. On the other hand, we are also seeing that in Mumbai markets, people are complaining that not many goods are available, but that distribution, due to the delay in delivery from the distribution side, all those loopholes are tried to be filled at the earliest. With camera person Anil, this is Neha for Mirror Now from Mumbai.
Well, as India witnesses a spike in coronavirus cases with over 5,000 active cases and over 100 deaths now, Centre has issued an advisory asking people to wear homemade masks to particularly when they are stepping out of their homes and not to take the risk. In fact, in many states now, we've actually seen that the governments have made it mandatory for you to wear mask when you get out. But that doesn't mean that you go outside and get yourself a medical mask or an N95 mask, which is essentially for healthcare workers. Times Network has now initiated a campaign, is leading a campaign called Cover Your Face campaign. Prime Minister has also endorsed the Times Network campaign of wearing a mask. Take a look at this report.
The world has come to a standstill, fighting an invisible enemy. By washing our hands, socially distancing ourselves, even locking ourselves at home to keep the deadly coronavirus out. But we all know that lockdowns are only temporary solutions. In the face of a growing body of evidence that the virus may be airborne, wearing masks as a habit is now essential. We at the Times Group have launched an initiative to drive awareness on the fact that wearing masks, even if homemade, is the best way to reduce the spread.
किसी की मदद के लिए जाते समय फेस कवर जरूर पहने, और मैं ये भी बताता हूं कि ये कोई जरूरी नहीं है कि जो डॉक्टरों के लिए निर्धारित हैं, जो नर्सिस के लिए निर्धारित हैं, जो पैरामेडिकल स्टाफ के लिए आवश्यक हैं, वैसे मास्क पहनना ही जरूरी है, ऐसा नहीं है। हर घर में किसी भी साधारण कपड़े से हम तैयार करें और फेस कवर रख सकते हैं।
Even the Prime Minister has endorsed this Mask India campaign that encourages all Indians to wear simple masks. From celebrities to ordinary people, everyone has welcomed the initiative and the campaign is growing by the minute.
Share with you what I learned from WhatsApp is to make my own mask. This little scarf I had in my own room, I brought this. I'm seen folding it. See, I'm folding it this way.
The fight may be long, but we're in this together. It's time to mask up and stay safe.
What has been recommended for mass public use is a face cover, which could also be in the form of a triple layer cloth mask, not surgical mask, cloth mask, or what government has suggested, a face cover.
Take any piece of cloth, even a handkerchief. We are all carrying a handkerchief. You can just, let us be innovative, Let's make it a triangle of it and cover it hard. This should cover your face so that even if you cough, the droplets are not going too far.
To prevent the wastage of N95s and to keep it for healthcare workers only, the general public should not use N95 routinely. They can use homemade masks, they can use cloth masks because they are not at direct risk or a high risk of getting coronavirus infection from infected patients.
Make your own mask and post your selfie or video on your social media page along with the Mask India, and we will feature the best picture on Times of India and maskindia.com.
Well, let's move ahead and get you the latest from the state of Tamil Nadu, where the Chief Minister held a review meeting today with 12 different coordination teams to review the state of affairs in Tamil Nadu. Pramod, in fact, is joining me with the latest. Pramod, I understand that the government says they have enough of protective gear for the healthcare workers. What is the future course of action? What's the plan?
Well, the first and foremost thing to say is that Tamil Nadu seems to have woken up a little late to the pandemic, and that's the reason. Within almost a 10 days period, the patient number flow has increased from 67 to 738 was until yesterday, and another 96 patients have turned positive today, pushing the number to 834 in just like almost 10 days time period. Now, the Chief Minister claims that, just like you mentioned, he has conducted meeting with 12 different committees, and when we put forward the question whether Tamil Nadu is also serious about extending the lockdown, the Chief Minister said that he has also constituted a 19-member medical team, and post communication with them and consulting with them, he would take a decision. So that way, the Chief Minister is also trying to, it looks like the decision to extend the lockdown in the state of Tamil Nadu is still under consideration, but nothing has been confirmed so far. However, on the other hand, the Chief Minister also said that 4 lakh rapid test kits have been ordered, and 50,000 is expected to be received tonight, with another 20,000 to be supplied by the center. So by tomorrow, 70,000 kits will be on the hands of the Tamil Nadu government, and they will initiate the rapid test kit. And the Chief Minister has once again said that all measures have been taken to make sure that Tamil Nadu does not reach the third stage, which is the community spread.
All right, Pramod, thanks so much, really, for bringing us that update from the state of Tamil Nadu. Well, let's get to the latest from Uttar Pradesh. Now, remember, we were telling you on how in 15 separate districts, the biggest of the cities from Lucknow to Kanpur and Varanasi, in Agra, Noida, Ghaziabad, there are specific localities where there is a complete shutdown that has now been announced. Now, as the government made this announcement yesterday, all of last evening, and this and first half of today, we saw people resorting to panic buying, completely unclear and unsure of what's going to happen next, if they will get the essential goods, and then rushing to the stores to get as much as they could. Here is a report that Prashant sent for us.
Minutes after the news broke out of sealing of various districts in Noida in the wake of rising cases of coronavirus across the state, what we are witnessing once again today is panic buying by people. People have very less access to information as to what exactly would be happening, how things would be delivered to their doorstep, because they believe that once the locality is completely sealed, they won't be able to venture out, and hence they want to hoard as many stuff as they can at home. Right now, I'm standing in one of the major markets of Noida. This is Uttar market, and it was quite normal, say 2 hours back, but ever since the news broke out that there might be a seal condition in Noida can be sealed, we are actually seeing serpentine queues actually emerging, not only in this store but across various stores here in this locality. In fact, I'll speak with one of the people here. what exactly has brought you here? Because abhi to kuch nahi tha yahan pe, and now I can actually see people standing in line.
There's the news flashing, so आपको नहीं पता कि next steps क्या है, whether they are going to deliver at their doorstep or what. कुछ भी अभी idea नहीं है, तो people are just rushing to the market and just buying whatever the basic needs they have, at least for 2 days stock or 3 days stock. After that, we will see what the milk supply will be there or not. No idea, everything clear, not clear idea.
So usually हम देखते हैं कि लोग सुबह में या तो शॉपिंग कर लेते हैं या तो फिर शाम में या शॉपिंग करते हैं. ऐसा क्या है कि आप दोपहर में आके भी शॉपिंग कर रहे हैं?
जस्ट न्यूज़ फ्लैश हुई अभी इस समय.
अच्छा, न्यूज़ देख के आप आए?
न्यूज़ देख करके आए
कि अभी सील कर देंगे.
हाँ, तो कल से निकलना मुश्किल होगा, तो इसलिए अभी से ले लो, मतलब कल के लिए तो कम से कम हो जाए.
तो एक पैनिक बाइंग का सिचुएशन फिर से आ गया. बिल्कुल. So this exactly is what is happening. This is once again a situation of panic buying here. The government on one hand says that they will be delivering all the essentials to people across the state on all the districts that will be under lockdown and sealing. But people say that they do not have any clarity on what exactly would be happening, and hence they want to ensure that they have enough supplies of essentials at their door, at their homes. That's the reason why they have now started coming out in the market, not only in this market but across various markets in Noida, and as a result of which we are seeing serpentine queues, social distancing actually being followed. In fact, I have one more gentleman with me. So what exactly has brought you out here? Because there was no queue at this particular market, say half an hour back.
Basically, the government is like doing the right thing, but everybody needs some routine.
So you came out only after you heard the news that there might be a sealing.
I want a milk only and some vegetable, because of pata nahi na aage kya hoga. So seriously, man.
So this exactly is the condition right now. People don't know what exactly will happen. People don't know how exactly they'll get essentials at the doorstep as being claimed by the government, and that's the reason perhaps why they have now come out on the streets in their local markets, local grocery shops, to ensure that at least they have some essentials at home stocked for now, at least till the time the sealing will be there.
Well, with that, it's a wrap on this edition of the Urban Debate. Thank you so much for joining us.